Hormones play a small role in it, but not the major role that people think. The things that I've talked about put women at 5 to 12 times greater risk for having struggles, emotional struggles in pregnancy. Hormones do play a role, but it's a very, very minor role compared to these things. These things are the main issue. Yeah.
Okay, I'm really surprised to hear this because I think a lot of women think that hormones have to play a huge part in what causes prenatal and postpartum depression.
That's true, Grace. In fact, the question that we're least asked in our work is, why do I have this? And I'm pretty convinced it's because women think that they know, they think it's hormones. And the problem with that kind of misinformation is that it keeps women from getting the help that might be helpful to turn this around early on. So for example, women who feel like they're struggling with some worry or some sadness in pregnancy might say it's just hormones. They might not get help. They might have it in their minds that once I deliver this baby, it's all going to be fine. The problem is that in most cases, it's not fine. And in most cases, prenatal depression and anxiety simply continue through the postpartum period. So thinking that it's hormones and that kind of myth or misinformation can keep women back from getting help that is necessary. And that's why it's so important to have accurate information.
So, practically speaking, what can we do to reduce the risk of prenatal anxiety and depression based on the risk factors that you've mentioned in this video today?
Right. Well, Grace, we're just starting a new blog series on risk factors, and they're going to talk more about these risk factors and more about how can you prevent them or what can you do about them, even things you can do yourself so that you can reduce the risk that they will play a role in anxiety and depression. And so I would love for women to go over to the blog, have a read, and tell me what you think. And I'd love to hear about your own experience.